Hello everyone, welcome back to Axon Health. Dr. Pinella here and
Dr. Abraham.
today we're going to talk about what the adjustment does. There's a lot of controversy, whether it's from what people say or with the research, what is actually happening when you get into manipulation, which is the main tool a chiropractor would use for the most part. So today Erica's going to talk about the neurology and I'm going to talk about the biomechanics of what actually happens when you get spinal manipulation. So Dr. Abraham, take it away.
All right. So, from a neurological perspective, there's quite a few things that can happen with the adjustment. I'm going to focus on two of them today. So, the first is with regards to pain. And pain is kind of the main thing that chiropractors see in their clinics. How does the adjustment help with pain? So, we have these things called mechanoreceptors and other things called nociceptors. So, mechanoreceptors tell your brain where you are in space. They fire, they say my arm is out here, to put it very simply. And then the nociceptors are your pain receptors. They are what go up to your brain, tell you that there's pain, noxious stimuli, you remove your hand from a hot plate, those kinds of things. So with regards to pain and the adjustment, when you get adjusted, it stimulates the mechanoreceptors, which tell you where you are in space within the joint, and then that helps to inhibit the function of the nociceptors. So you can kind of think of them like on a teeter-totter. One goes up, the other goes down. Increase mechanoreception, decrease nociception, decrease pain. So that's with regards to pain. The other thing that research has shown us a few times is that it can actually influence what's called your parasympathetic and your sympathetic nervous system. So your parasympathetic nervous system, to put it very simply, we call it rest and digest. So rest and digest meaning the things like if you're just sitting watching TV, that's kind of what should be happening with your body. Your body's able to digest your food properly. You're in a more relaxed state. So certain organs function better under that. And then we have the sympathetic nervous system, which is called your fight or flight. And other organs will be upregulated with that. You feel your heart racing, you breathe a little heavier, things like that. So that's your sympathetic, your fight or flight. And what some research actually finds is that manipulating certain areas of your spine either upregulates one or the other. So they're finding that upper cervical typically upregulates parasympathetic function, and so does lumbosacral, so the very bottom of your spine. And then to upregulate sympathetic, it's typically within your mid-back, what we call your thoracic spine, which is where all of your ribs attach. So that is what I'm going to focus on for the neuro aspect of what happens with an adjustment today. And I'm going to throw it over to Dr. Pinella for the biomechanical stuff.
So one of the major things, people want to ask me a lot, what is your philosophy about chiropractic? And I adjust based off of a mobility standpoint. Both parts play an equal effect when it comes into what is actually happening during spinal manipulation. But how many people that we all know that have very bad mobility? Even if your SI joints have small mobility in general, people sit all day. They're not healthy. They're not going outside. The majority of people, especially in the United States of America. So the biomechanical research on adjustment is pretty good when it comes to increased range of motion. Now, whether that increase of range of motion is, temporary or long-term, because it is specific on the individual, whether you want to call it holding an adjustment or so forth. But the good thing about biomechanical, and then going back to the video we did on physical therapy with chiropractic, if someone gets a chiropractic manipulation, it increases the range of motion, in their cervical spine, and then they go into a physical therapist, that physical therapist potentially has more range of motion to stabilize in a greater range of motion. And as we know, motion and movement is one of the foundations of just biomechanical happiness. Your body likes, I like that. Your body likes to be able to move. We all know someone who sits on the couch all day, has bad mobility, and there is one quick thing I do want to state in this video, and I will talk about this in a separate video. One of the biggest misconceptions when it comes to increased range of motion, so we have joint mobility, muscle flexibility, and then stability, which is a combination of, say, joint and muscle fibers. But you could have poor range of motion and poor muscle flexibility, But if you're stable in that range of motion, it's not problematic. And that's a big misconception. But what happens is when people go outside of that range or they've never gone there and maybe an adjustment brings you to that range, it can be a little awkward for the patient because they've never been in that type of a range of motion before. But we'll talk about in a different video. But that is the two things that the chiropractic adjustment does. There is one thing we wanted to talk about real quick. Is the adjustment safe? We're not going to provide any research in this video because we will do a separate video on the safety of the adjustment. But we think that's an important topic when it comes to talking about spinal manipulation.
And the short answer is yes, it is.
Is yes. So good call, babe. Thank you for watching. We appreciate you tuning in, and we hope you have a good day.
Have a good day, guys.